Hello everyone, we are Gawrdians. We're a team of medical students from the Chinese University of Hong Kong. We aim to design a way to offer immediate mental health first aid and personal mental health assistance for the general public, especially teenagers, to reduce depression, anxiety, and burnout in adolescents in Hong Kong. And this is the list of our team members. Our idea stems from the youth psychiatric problems in Hong Kong, as there is a significant prevalence of mental disorders, including depression and anxiety among children and adolescents in Hong Kong, evidenced by research done by different universities in Hong Kong and also some charity organizations. Worse still, there is an alarming high rate of adolescents who possess suicidal ideation. Despite the high prevalence of mental disorders, many children and adolescents with mental disorders tend not to seek help from professional counseling service. This shows the lack of awareness of importance of counseling support and therapy. On the other hand, there's a high demand of doctors and other professions in psychiatry, which shows the lack of supply of psychiatric services. So the current gaps we identified are the lack of psychiatric professionals to handle the increasing number of children and adolescents with mental disorders, and the lack of awareness and accessibility to provide professional counseling support for children and adolescents with mental disorders. So how can our solution help? We developed a gamification app that targets secondary and university students to reduce their depressive symptoms and lower progressions to disorders. This is incorporated with elements of cognitive behavioral therapy, which include elements of AI-powered chatbot delivering SSCBT microsessions, daily mood symptom tracking, and gamified quests and rewards. And this model involves the use of transformer-based large language models to deliver the SSCBT microsessions and conversations. So cognitive behavioral therapy has been proved clinically effective for youth with subclinical depression and to reduce anxiety and related symptoms compared with no treatment. And digital delivery of CBT with the embodiment of AI is also of research evidence efficacy. So our approach is to provide a clinically grounded, preventive, and engaging approach to help these students with mental disorders. So here is a table showing the app features and the targets of each of these features.
So hello guys, this is Jaden from Team Gawrdians, and today I'm going to present to you our prototype. So this is the therapy chat interface, and initially the user can choose from a cat or a dog as their pet. And we have really named our pet. I name my cat Neko here. So we can choose our emotion we're experiencing today and its intensity. So hi. As you can see, there is some action of the pet, and we will try to put it into animation later as we develop further. So it is trained to respond rather empathetically, and it will ask guiding up questions to help you think through some delusions and help you detect if your emotion is disproportionate to what you are actually experiencing, which is actually the activating event in CBT. So we unlock our emotional intensity after each chat session, and we trace our emotional journey with this. And this is very important for user to understand his or her emotional status over time. This is training quest, and we have a daily streak system, completion bonus, and weekly check-in. And most importantly, our daily plans. The user can freely choose from a list of quests that what he or she likes and practice it every day. So for example, mindful moment basically teach you how to breathe mindfully and focus on yourself. Records of Gawrdians is basically a crash course on mental health, teaching you how to think, teaching you how to tackle delusions and how to think empathetically. So the users can try to apply what they have learned in Records of Gawrdians to Positivity Clinic, which every day there will be a case of traumatized pet updated here. So the user can try to use their empathetic skills and the CBT skills they have learned to treat the pet. This is a gamification component of Battle Quest, and this is a very essential part of the app, which is pet customization. So the player can equip the pet with their own accessories and own companions as well. And the actually for accessories, there is customization component which is known as Gawrdian Blacksmith. The user can get ingredients and cards from gacha rewards, and the currency for gacha rewards is basically tokens, which can be earned from doing daily quest, positivity clinic, and also records of Gawrdians. So here are some blueprints, and the users can use the ingredients and cards to synthesize whatever accessories they like. So this is community function, which the users can share their own emotional journey and their moments with their pets here. It's very important since prolonged chatting with AI will cause social detachment, and it's very important to have real person support and connection as well. And this is the augmented reality feature, which the user basically can open their phone camera and then it will show a dynamic interaction with the environment and the pet. The user can drag their animated pet onto their phones and take photos together and to commemorate some special moments. The user can also save the photos taken into galleries or share to the community as well. And here basically sums up the key features of this prototype, and I hope you enjoyed it, my demonstration.
Thank you, Adrian and Jaden. Our primary target users would be Hong Kong secondary school and university students with usage scenario of 15 to 30 minutes per day. We use a freemium model for individuals and a low-cost B2B license for institutions. They get anonymized trend data to plan support, and students get premium access with no stigma and no extra cost. This helps them support students' well-being with limited counselor capacity. For deployment, our phase 1 will be a free pilot with 1 to 2 schools for 48 weeks to validate engagement and safety. We want to test for certain metrics like engagement, user satisfaction, feature preferences, and pre-post mood changes. We ensure safety by an embedded crisis protocol to route users to hotlines and campus support. Then, in phase 2, B2P license allows businesses to legally use, operate with, and distribute our service at lower per user fee. Ethical considerations are particularly important for a mental health care app. Our pet restrains itself from presenting as a professional and always encourages real-world help if symptoms are severe or risk is detected. Also, in our crisis protocol, if users mention self-harm or suicidal thoughts, the app provides local helplines and urges immediate human support. Finally, to avoid over-attachment and dependence, we have set up features of daily time limits, regular nudges to connect with real people, and community features that emphasize peer and offline support. How do we keep the business sustainable? Long-term sustainability will come from high daily use due to the pet game nature of our app. Subscriptions, when users convert from free to paid version for more personalization, features, and depth. Stable B2B contracts like school-wide licensing that renew annually and may expand to more cohorts. In the future, first, we plan to add psychologists or psychiatrists verified useful contents to make it more informative. Second, with collaborations with local hospital and university departments for content reviewing, we want the app to be clinically validated. Third, with psychiatric and psychology clinics, we plan to suggest users with deteriorating mental health for referral to certain clinics to allow early access to care and ultimately better treatment outcomes. Last but not least, if we are fortunate for more time and resources, it can cover the LLM and server costs for pilot users. Clinical and UX consultations with psychologists or experts review our scripts and safety flows and further blended development. In addition, we will continue to work on security issues like privacy policy and compliance with mental health app development guidelines.